Did you know a single government policy threatens maybe 4 million American jobs, could curb life-saving innovation, and might push us closer to socialized medicine, all under the guise of lowering drug costs?
That's quite an opening, and welcome to the deep dive. That sentence really captures the intensity surrounding the policy we're diving into today.
Yeah.
The most favored nation model, or MFN, for drug pricing.
Yeah, we received a listener submission with a whole stack of material focused squarely on the, let's say, furious opposition to MFN, mostly from conservative think tanks, free market groups.
Right.
So our mission today is to really get under the hood. What is this MFN thing? Where did it come from politically? And why is there such an explosive critique calling it flawed, dangerous, maybe even unconstitutional?
Okay, so to set the stage, we really have to start with the stated goal of MFN. And, on paper, it sounds pretty straightforward, even appealing to a lot of folks.
Yep.
The basic MFN principle says the U.S. government shouldn't pay more for a specific drug than the lowest price charged for that same drug overseas. Simple as that. Get the best deal, basically.
And the reasoning behind it is pretty powerful, isn't it? The argument is that the current system is just, well, broken. Americans end up funding something like 3/4 of global pharma profits and innovation.
Right, exactly. The narrative is that other developed nations are kind of freeloading. They benefit from the R&D funded by higher U.S. prices while paying much less themselves. MFN is pitched as the way to stop that, to get price parity.
You hear stories, right? A cancer drug costs, say, 10 grand here, but only 3 grand in Germany. MFN promises to bring that German price stateside.
That's a promise. It taps into that feeling of unfairness.
Okay, I get the surface appeal, but, we've seen this before where a simple-sounding policy runs into major problems in the real world. So let's unpack the critique. How can anyone argue that getting lower foreign prices is actually worse?
Well, that's where it gets interesting. The opposition doesn't just disagree. They frame MFN immediately as disruptive. Not a price equalizer, but a dangerous import of foreign price controls.
Price controls, that's the key phrase.
Definitely. Groups like Americans for Tax Reform, other conservative and libertarian organizations, they've been really vocal, urging the government to just withdraw the whole idea. Their central point: you're copying socialist price structures from Europe and trying to paste them onto the American free market system.
So experts, like from the Cato Institute, they call it wrong-headed.
Yeah.
Because price controls always backfire.
That's their argument. They point to historical examples like, say, rent control. You put an artificial cap on prices, whether it's housing or complex drugs, and you distort the market. It moves the system towards government control, towards socialism, and critically, it produces shortages.
Shortages. Okay, so that leads from the sort of ideological argument to the patient impact, right? What happens to actual medical innovation if you cap revenues like that?
Exactly. Opponents argue MFN will inevitably cause a sharp drop, a decline in medical innovation. Fewer new treatments, fewer cures making it to patients.
And they have numbers to back that up, because the U.S. does lead in medical development currently.
They do, and the data they use is pretty striking. It highlights what they see as the benefit of the current U.S. system, warts and all.
Like what?
Okay, so between 2011 and 2018, patients here in the U.S. got access to almost 90% of new medicines launched globally. 90%.
Wow, okay. And how does that compare to countries using the kind of price controls MFN would import?
Big difference. The UK, which uses price controls, they got access to about 60%, Canada 44%, and Spain only 14%.
14 versus 90, that's stark.
It is, and according to these critics, that's the direct result of cutting off the potential for profit. Less money means companies take fewer risks on expensive long-shot R&D. Fewer breakthroughs get funded because the return on investment just isn't there anymore.
They also bring up the COVID vaccines, don't they?
Oh, heavily. They argue the U.S. free market system, even with its high prices, allowed for incredibly fast vaccine development. And undermining that system with foreign price caps, well, they say it threatens the next generation of life-saving drugs.
So the core idea is, if America stops paying the innovation premium, the whole global engine for drug discovery, which is mostly based here, just sputters out.
That's precisely the fear they articulate. And that economic slowdown, they argue, hits American workers directly. Medical innovation isn't just about health. It's a huge source of high-paying American manufacturing jobs.
Right. You mentioned 4 million jobs earlier. That's a huge number. How do they break that down?
The sources point to about 800,000 direct jobs in pharmaceutical R&D and manufacturing.
Direct jobs.
But then you add in the whole ecosystem, the suppliers, the research labs linked to it, the induced economic activity, and that number swells to over 4 million American jobs. High-paying, skilled jobs, the kind critics say we should be protecting, not, risking by importing foreign price schemes.
And that jobs argument connects to the bigger fear, the slippery slope to socialized medicine. How does putting price controls on some drugs potentially lead there?
The critics see MFN as the thin end of the wedge. It starts by imposing price controls on Medicare Part B drugs.
Let's clarify Part B. Those are drugs given in a doctor's office or hospital, right? Often expensive specialty drugs.
Exactly. High-cost stuff, often for cancer, autoimmune diseases. So the argument goes, if the government successfully imposes controls on this critical, expensive part of Medicare, what stops them from expanding it? It opens the door, they believe, to total government price setting across the board.
Which they say leads to predictable outcomes. Huge tax hikes, people losing their current insurance, and the really scary one, healthcare rationing.
And rationing isn't just a hypothetical, they argue. They point to countries with socialized systems and price controls as proof it happens. The argument is, when you starve the system of funds through price caps, first innovation suffers, then access follows.
They had UK data on that.
Yeah, the sources mention that in 2019, the UK, which has price controls, faced shortages of 10,000 doctors, 43,000 nurses, resulting in something like 4.5 million patients waiting for hospital care. The connection they draw is price controls degrade funding, and degraded funding inevitably hurts patient access.
Okay, so if the policy is seen as so damaging by these groups, why does it keep popping up? Why the push from the executive branch?
Well, that brings us to the whole implementation mess, the legal challenges, the constitutional questions, because MFN hasn't generally been pursued through Congress, has it? It's been executive actions.
Right. Sometimes from the previous administration, sometimes more recently. So how does trying to do this unilaterally create problems?
Huge legal vulnerability, according to the opponents. They argue trying to implement MFN via executive order, especially using this agency called CMMI, is basically an unconstitutional power grab.
CMMI, Center for Medicare and Medicaid Innovation. What is that exactly?
It was created under Obamacare, and its official purpose is to test new payment models within Medicare and Medicaid. Just test them.
So the critics say the executive branch is using it as a loophole, calling MFN a test model to avoid needing a law passed by Congress.
Precisely. They argued this violates Article 1 of the Constitution, which gives lawmaking power solely to Congress, not the executive branch acting through an agency test program.
And this isn't just theory, right? Didn't the first version of MFN get stopped in court?
It did, blocked by the courts on pretty similar grounds, preventing it from ever taking effect. So the critics see it as built on really shaky legal foundations.
There's also that counterintuitive point they raised that MFN actually surrenders to the foreign freeloading it claims to fight.
Yeah, it's a sharp critique. Instead of pushing other wealthy nations to pay more for innovation, the U.S. just lowers its own prices to match their arguably artificially low socialist set prices. It's like giving in, not fighting back.
Okay, so legal issues aside, even if MFN somehow got implemented, how would the drug industry react? Could they just work around it?
Well, the sources suggest the industry is absolutely prepared. They seem to have clear tactics ready to basically neutralize MFN if it ever becomes binding.
What kind of tactics? This shows how these things play out in reality.
Two main ones stand out. First, manipulating the reference price itself.
How?
They could raise the official list price in the foreign countries MFN uses for comparison. That's the number MFN looks at. But then they could give those foreign governments secret confidential rebates or discounts.
So the real price paid overseas stays low, but the official price used for the MFN calculation is higher.
Exactly. So the MFN calculation uses an inflated number, and the intended price drop in the U.S. doesn't really happen. It defeats the purpose using hidden deals.
Pretty clever. What's the second tactic?
Even simpler, maybe cruder. Drug companies could just stop selling their most valuable, innovative drugs in the specific European countries that have the absolute lowest prices.
Pull the drug out of that market.
Yep. If the drug isn't sold in, say, Greece because the price is too low, then Greece's price can't be used in the MFN calculation to lower the U.S. price. They protect their main profit center, the U.S. market, by sacrificing smaller, low-price markets.
We have seen some recent news, though. Deals with companies like Pfizer, AstraZeneca, offering MFN-like pricing for some drugs. Doesn't that show it's working?
Critics dismiss those pretty quickly. They often call them gimmicky self-preservation.
Like gimmicky.
Because often these deals apply mainly to Medicaid drugs, and Medicaid prices are already massively discounted. The sources say over 68% sometimes, thanks to existing mandatory rebates.
Yeah.
So offering an MFN price on top of that gives away very little.
It doesn't touch the core issue.
Right. It doesn't fundamentally change the high prices in Medicare Part B, where MFN was originally targeted, or in the large commercial insurance market where most people get their coverage and where spending is huge. It's seen as a strategic concession, not real reform.
So wrapping up this deep dive, it seems the MFN model, even with its aim of lowering costs and tackling that freeloader problem, faces this really powerful conservative critique. They see it as importing foreign price controls, pure and simple.
And they argue it puts over 4 million American jobs at risk, stifles the medical discovery process that the U.S. currently leads, and dangerously nudges the whole system towards rationing and ultimately socialized medicine. For them, it's an unconstitutional overreach that actually gives in to foreign lowball pricing instead of fixing America's own complex issues.
Which leads to a final thought for you, the listener. Given the serious constitutional questions that have already blocked MFN in court, and the industry's pretty clear ways to game the system either by hiding real prices with rebates or just pulling drugs from low-cost markets.
Maybe the focus for real, lasting price relief needs to shift. Move away from this easily defeated international reference pricing idea and look more towards domestic reforms. Perhaps something like forcing drug companies to reveal the actual net price, the real price, after all discounts across all payers. Would that transparency be a more effective route than chasing foreign price controls?
Something to think about.